So tackling the ethnicity, pay and progression gap is vitally important. For the first time, we have a greater number of diverse doctors on the GMC register, and this is a problem that will not go away. We need to think about the human cost and the actual human stories behind the numbers. For every person who fails to progress, it impacts on their health and on their well-being. And if they don't get the support that they deserve in order to be able to progress, then they could fall out of the workforce, and we need to make sure that that doesn't happen.
The idea of the panel today is to understand truly what we can do next and the actions that we can take to make sure that we're not in a case 10 years from now with the same issues that we have today.
What I want people to take away from my session is that diversity is actually very beautiful. We should celebrate it a lot more, and really encourage staff who come to really shine. So to bring their experiences, their skills, their energy, their passion and enthusiasm to be part of the team and really contribute.
This has been an amazing day, an event where we have people not just from the NHS, but from wider communities across the Midlands, talking about the importance of the pay gap. I think I've heard this morning people talking about how it affects people's morale, engagement with staff, and also some of the matrix that we have in the NHS around sickness and well-being.
What we know is that if you come from a different background, if you are somebody with additional melanin in your skin, what happens is you have a poor experience of working in our NHS. That has to stop because it's not fair, it's not right, it's not equitable. It has to stop because actually it's about patient care, patient safety and patient satisfaction. We also know that it saves money, but ultimately it's about the quality of care for patients. So making sure that all our staff, regardless of where they've come from, regardless of their background, actually have a fair and equitable service or treatment within our NHS means that our patients will have better care. That's what we're all about.